All right, so let's talk some more about specific diseases affecting the respiratory tract. So next up is pertussis, which is often called whooping cough, and it is caused by the bacteria Bordetella pertussis, which is an obligate aero. So with whooping cough, there are two distinct symptom phases, the catarrhal and the paroxysmal stages. Then there's going to be this long convalescent period. So think back to when we talked about stages of a disease. The convalescent period is like a recovery period where you're starting to feel better. But it's actually during this time where patients are susceptible to other respiratory infections. Okay, so let's dive a little bit deeper into this. So about anywhere from 3 days to 3 weeks after infection, the catarrhal stage is going to begin. And so this stage is really characterized by those general cold symptoms, especially like a runny nose. And these symptoms are going to last for about a week, maybe 2. But then the second stage, the paroxysmal stage, is worse. Okay, and so this is the stage where that characteristic severe and uncontrollable coughing is going to occur. And it gets its name, the paroxysmal stage, because those refer to convulsive attacks. And so they're going to have these uncontrollable coughing fits where the patient is going to make that very characteristic whooping sound as he or she tries to grab a breath in between those uncontrollable bouts of coughing. Now, this coughing is really, really intense. It can cause blood vessels of the eye to burst. Some patients are going to vomit. Worst case scenario is that a seizure can result from all the small hemorrhages in the brain. The coughing is also going to damage the cilia on the respiratory tract of epithelial cells, and that can take weeks or even months to recover from. And so secondary infection is very likely to occur. So in order to successfully infect a host, Bordetella pertussis must be able to attach firmly to the epithelial cells of the mouth and the throat. And it has, specific virulence factors that help it do so, including the filamentous hemagglutinin, which is also called FHA. And this is a fibrous structure that is actually surrounding the bacteria, much like a capsule, but it can be secreted and act as a bridge between the bacteria and the epithelial cell, which is kind of snazzy. So once attached, the body is naturally going to produce a lot of mucus and localized inflammation, which is going to be the cause of those early catarrhal stage symptoms. But what happens now is multiple exotoxins are going to be released, and these exotoxins target that ciliated respiratory epithelial cells, and that's going to cripple phagocytic cells. And so 2 of those exotoxins are going to be the tracheal cytotoxin, which is inhibiting the movement of the cilia, and then the pertussis toxin, which is increasing mucus production. Okay, so it's essentially clogging up the ciliary escalator, which is going to prevent the ciliary escalator from doing its job of removing these pathogens. But now notice there are additional toxins. Okay, this bacteria has toxins up the wazoo. The adenylate cyclase toxin is causing our body to increase mucus production because we're trying to slow down those white blood cells. Okay. And then there's going to be the dermonecrotic toxin, which is actually going to cause the constriction of blood vessels and eventually hemorrhaging of blood vessels, which can lead to cell death and tissue destruction. Okay, and so this is a really, really serious disease. All of that coughing can lead to severe oxygen deprivation, and so you'll often see, especially in kids, they're coughing so much they can't get any oxygen that they start to turn blue, and it can lead to severe brain damage. So treatment options are available and effective during the catarrhal stage. But again, those are, general cold-like symptoms. And so a lot of people don't suspect whooping cough at this point. But once it progresses, it can be really, we're really limited on options. And so again, that DTaP vaccine is going to be the best form of prevention. All right, next up is influenza, also called the flu. And this virus has a very short incubation period compared to a lot of other viruses, about 1 to 4 days, but normally about 24 hours. After this, the patient is going to have like a headache, dry cough, aches, fever, stuffy nose, sore throat, right? Nothing terribly obvious, but they do tend to be really, really tired. And that fatigue is going to be what's going to last days to even weeks. And so, excuse me, a lot of people kind of ask, what's the difference between the cold and the flu? And because they do have a lot of similarities, right? There are these contagious diseases that affect the respiratory system, okay? They are caused by very different viruses, okay? With the common cold, I don't think I said it out loud, but I was listed on the PowerPoint. Rhinoviruses and coronaviruses have been associated with the common cold for a very, very long time. I remember the rhinovirus because I'm a big baby, and so I feel like I've been run over by a rhino when I have the common cold. So the flu and the common cold do have very similar symptoms, but the flu tends to be worse. And much more intense signs and symptoms. It tends to come on a bit more abruptly as well. But one of the big things is that there are some pretty severe complications that can arise as a result of the flu. Because that extreme fatigue and these signs and symptoms can last much longer, right? They're more susceptible to secondary infections. And so you tend to actually see more things like, hold on, I just lost my train of thought. Oh, you tend to see people that get the flu will end up getting things like pneumonia, which can obviously be very, very dangerous for certain populations. And they can also, some of these complications can actually be life-threatening. So not all of the complications of the flu are quite that, dramatic. A lot of times you do see things like ear infections or sinus infections. But like I said, it can lead to things more serious, like pneumonia or even myocarditis, which is going to be inflammation of the heart. Myositis, I always say that wrong, which is inflammation of the muscle tissues. And in some extreme cases, it can lead to things like multi-organ failure, because it can also trigger like extreme inflammatory responses that can lead to sepsis. So you don't typically see these types of complications arising with the cold. So just something to kind of keep in mind, because the most flu symptoms aren't terribly scary, but it's those complications that can arise that do make it different from the cold. So what are some virulence factors associated with the flu? Well, neuraminidase, which actually helps the virus separate from cells when they are leaving the host. We talked about that a little bit back in our virus conversation, where we talked about how some viruses exit via budding or exocytosis. Influenza virus also has hemagglutination spikes, and these are the spikes that allow them to enter into the host cell. And we call them hemagglutination spikes because when we mix this virus with blood, hence the heme part of the name, it causes the red blood cells to agglutinate. So hemagglutination literally means red blood cells agglutinate. So pretty snazzy, I think. We are also concerned with antigenic shift and antigenic drift. And so because influenza is an RNA virus, it does not have the same like proofreading mechanisms that DNA viruses can use, right? Because they're stealing the host machinery, and the host, us, naturally proofreads DNA. We do not proofread our RNA because we don't need to, right? By proofreading the DNA, we're essentially proofreading RNA. So RNA viruses don't have this because they have RNA and not DNA. And so they mutate very, very quickly. And those mutations are a result of antigenic shift and even antigenic drift. So that's why people get a flu shot every year, because the flu can mutate. And so it's best to get a flu shot to try to reduce the odds of getting the flu and those complications that can arise from it. So antigenic drift is going to be kind of the accumulation of mutations in the hemagglutination spike and neuraminidase. That's normally constrained to like a given area. With antigenic shift, it's going to be these major antigenic changes due to reassortment of genes. So essentially, it's just able to change those surface molecules that we might have vaccines against. But there are treatments for the flu, right? Some antivirals here that are essentially targeting these key virulence factors, and especially neuraminidase, because by not allowing the virus to get into the host cells, right, we can try to prevent or alleviate those signs and symptoms associated with it. All right, we're going to end this video with a very brief chat on anthrax, because we did talk about it more back with skin diseases. I really don't have a great picture of inhalation anthrax, which we also call pulmonary anthrax, which is what I'm going to be talking about for just a few moments. So I know there's that picture of the ESHAR. It's just a reminder of the key diagnostic indicator for cutaneous anthrax. Okay, it's the same slide. I just want to talk a little bit more about the inhalation or pulmonary form of anthrax, because this is the most fatal. It's about 100% fatal, because when we inhale those endospores, because remember, this is caused by the organism Bacillus anthracis. Bacillus as a genus can form endospores. So if somebody inhales those endospores, it's possible to get into the bloodstream and affect the respiratory system, which case it can be 100% fatal. So what are some signs and symptoms of inhalation anthrax or pulmonary anthrax? So you are going to see some basic symptoms, right? There might be a cough, fevers, chills, body aches, but some more kind of alarming symptoms are going to be discomfort in the chest, right? Because it's affecting the lungs. Often there'll be shortness of breath and sweats, and I mean drenching sweats, okay? And then extreme tiredness as well. And so when it comes to preventing anthrax, anthrax is really pretty rare. The vast majority of people aren't ever actually going to be exposed to it. There is a vaccine for anthrax, but it's really only recommended for use in certain people, like members of the military that might be targets for bioterrorism, perhaps. I actually know several people in the military that have had to get it, and I hear it's a pretty painful shot. I knew one guy that actually considered not re-enlisting because he didn't want to have to get the anthrax vaccine. It was that bad. It's kind of surprising, but I've never heard anybody say it was a pleasant experience. But it is, what else do I want to mention? I think really that was all I really wanted to say. It's not really a big concern here, but again, key people that may come into contact with it or are at risk of being targets can get the vaccine. All right, that's going to wrap